Hello, I am Dr. Farshad Amini Behbani and this is short course of Iranian traditional medicine. In this section we discuss about diagnosis through expels of the body. We have several expels from the body which by evaluating them we can reach to a better diagnosis. Sweats, eye discharge, tear, ear discharge, nasal discharge, sputum, saliva, vomiting content, feces, urine, menstruation blood, vaginal discharge, semen, blood from venesection, wet cupping, or any wound in the body, or pus, if there is any, as an abnormal discharge, is expels of the body that we can reach to a better diagnosis or evaluating them. In evaluation of expels, we focus on several factors. Consistency of the expel is important. Usually, expels should be in consistent form. If you see 2 or 3 phases of an expel, it is usually considered as an abnormal expelling, especially in sputum or in defecation, for example in feces. Color of expels, odor of expels or smell of expels is important also, and taste of expels if it is tastable by the patient. For example, taste of sputum, taste of saliva, or taste of sweet. Sometimes patients report them. And amount of expel is important also. Turbidity or clearance of expel is important. And burning sensation or easily or difficulty of defecation is important through expelling. We can reach to them by taking a history from the patient. Usually, in short course of traditional medicine, we just teach urine as an expel because it is most important expelling, one of the most important. But let me tell you some clue in evaluation of other expel of the body. Usually, strong odor, strong smell is a sign of warmness. Smellless or odorless or weak smelling is a sign of coldness. Bad smelling is a sign of infection. Burned smelling or feeling burning from smell of the body, smell of expels of the body is a sign of warmness. You should take a notice that sometimes warm signs are normal for a young person, and cold signs also are normal for old person. In an old person, sweat, feces, and urine are odorless, and in a young person, these 3 expels have a strong odor. If we have a strong smell in an age that we do not expect warmness, it is considered warm distemperament, and reversely for coldness in a warm age. In evaluation of color, you should notice that each of humor have their related color. Yellow is related to yellow bile, Black is related to black bile. Also, green sometimes is related to black bile. White color is related to the phlegm, and red is related to the sanguine humor. But in expels, usually red color is not the sign of dominancy of the blood or sanguine humor. It is a sign of bleeding, or it is a sign of weakness of an organ to hold sanguine humor. For example, in sweet, if you see the red color and you do not eat or consume any color changing food or drug, it is considered as a weakness sign. And you should consider that stickiness in the expels usually is a sign of dryness or a sign of sticky material or sticky humor like phlegm. And foamy form or bubble form in an expel is a sign of wind as a cause of disease. If these bubbles are consistent, it is usually with an sticky humor or thick humor. So, consistent bubble usually is considered as a sign of both thickness or stickiness and wind as a causality of the disease. Let's talk about urine. Urine is better to gather in the morning by first voiding, and it is better to gather all of the first urination in a glassy bladder shape clear glass jar. It is better evaluated in the daylight in indirect light of the sun, and it is better that we wait 1 hour to let the sedimentation to be gathered at the bottom of the jar. It is a practice for you and for each student of traditional medicine that gather first urination for 1 year and evaluate its color, its sedimentation, its floatings, its bubbles for at least 1 year and compare it according the last night meal or last night actions that you have. A normal sedimentation of urine is a fine, white, uniform sediment at the bottom of the jar that disperse easily by shaking the bottle or stirring the urine and gather slowly after that at the bottom of the jar. Any abnormality in color, any abnormality in size and shape, any abnormality in consistency, any abnormality in the place of this sedimentation is considered as an abnormal sign. For example, if you have too much phlegm in your body or eat too much food or different food with each other in last meal, you have a cloudy sedimentation at the middle or at the top of the jar with white and net form, with white color and net form shape. This is a sign of phlegm urination. And you should consider some fasting or some management in your food and beverage after that. Usually, it could be considered as a normal sign because of today style of lifestyle. We have all extra phlegm in our body. Another factor that you should notice in urine evaluation is consistency of the urine. Shake slowly the urine bottle and see if it moves easily like water, which is considered as diluted urine or fine urine, or it moves like honey, it moves hard, it moves slow like honey, which is considered as thick urine with its diagnosis. Another test is turbidity. You should easily read a handwriting behind the jar. If you could not see it, you have a turbid urine that can, because of the pus in the urine, because of too much phlegm, because of too much blood, because of too much melancholic humor in the urine. Turbid urine is an abnormal urine. Another test is the color of the urine. Usually the yellow, normal yellow color is a yellow that it is not white or it is not orange. Orange or saffrony yellow or bold yellow is considered as warmness sign, and white yellow is considered as cold sign. Of course, if you have too much yellow bile in the body, you have a bold yellow color of the urine. Black color of the urine is usually because of melancholic humor in the urine. Green color is also considered as melancholic humor, and it is considered also as a cold sign. There are two green color that is considered as warm sign: grass like green color and blue like green color, I mean copper oxide blue, that is considered as a warm sign. Bluish yellow is considered as a sign of pregnancy also. Red color is considered as a sign of bleeding or weakness of the kidney to hold sanguine humor. And another factor is oily material above of the urine at the top of the jar, which is a sign of too much warmness and melting fat of the body or fat of the kidney. It is a dangerous sign of fevers. In fevers it is abnormal. And of course sometimes it could be because of oil or ointment which patient use. For example, vaginal ointment can cause floating oil at the top of the urine, which is normal. And foam above of the urine, bubble at the top of the urine is important. If we have too much bubble, we have wind in the body, and if these bubbles are consistent, we have a thick humors, thick material in the urine. It could be because of using sticky and thick foods with difficult digestion.